Peter Kim. Last week we talked about the broad definition of professionalism, practice, and then the ethics. Mostly we talked about what is professionalism last week. In the beginning of the class, we do a little bit of a review. Okay. Actually, professionalism is like set of behavior, quality, and attributes. Then also, when we do good professionalism practice, it is expected from individuals in a given profession, like doctor, professor, computer, technician, and experts. Those kind of workplace you could do. You are expected to certain kind of professionalism. Then also that helps maintaining a good, positive, and productive work when we have good professionalism. That's the result. Okay. Also, at the end of also a visual, the outcome of good professional. To addition to it, we make also good relationship with people, clients, colleagues, and to the publics. That makes good trust when we have good professionals. Okay. Okay. Also, we talked about when we practice in terms of good professionalism. There's a certain kind of key elements, which is competence. And competent is knowledge, skills, and expertise to perform certain kind of job or task. That also we need to have ethics, integrity. Okay, ethics, which includes honesty, transparency, moral principles. Moral principles like what is good, what is bad, what is wrong, what is right. Those kind of things is moral principles. Also, we need reliability, accountability. Reliability is you have to have a certain kind of skill and knowledge. If you have a certain kind of task, you have to do on your own, ability, and then with knowledge. That's reliable. Also, accountability is, in another word, that's responsibility. Okay, so also reliability means you have to do finish a certain kind of task before the timeline ends. Actually, deadlines. You keep promises. Also, you have to have ownership of your job or task and work. That's accountability. Okay. Also, we need respect. We give respect to people, to your job. Also, we have to do practice. Fundamental aspect of colleagues, clients, customers, or individuals with respect. Communication skill. Also, the communication skill is very, very important in terms of professionalism. Effective communication is making good professional products. Also, communication skill means verbal communication. In addition to it, also written communication is very important too. Another key element is dress appearance. Certain kind of professional, we have to have a dress code, right? So that means also that's part of professionalism. Okay, adaptability. You have to adapt. You have to kind of transform to yourself environment, to the job or certain kind of task. That means you are open to any changes and adapt to evolve circumstances and technologies. Okay, it's like now people use smartphone, tablets, but or certain kind of new technology with computer. If you don't know it, if you don't study those things, I don't know anything about the computer yet, so I'm gonna do kind of paperwork only. That's not possible nowadays. So you have to learn, you have to adapt yourself to technologies and circumstances. That's the adaptability. And teamwork, collaboration is also very important to become yourself professionalism. Collaborate, you have to certain kind of job to do in a month. For example, you have to uh, divide the time, or you have to divide separate the task with people. So let's say I'm gonna do beginning of the task, then another person with the middle task, also another person do last, or let's say three people work together, they do certain kind of task all together, finish and then go on to next task. That's the collaboration. Also confidentiality, that's also important to do it. That's very, very important. Certain situations like hospital, let's say hospital professionals, they don't release very sensitive information about the patient to the public or any person that because when that's the also unethical in hospital profession, that also use patients, somebody use patients information in a bad way. So when you are the victim of personal ID, and then the information, you can be sued, right? So that's very important to keep the sensitive information private. Okay. Also continuous learning, that's also connected to adaptability. Okay. Effective communication. Okay. And then also we talked about the goal of Christian professionalism. Okay. When we do like you're a pastor, you're an evangelist, you are a missionary, we have to have a certain kind of ethics, morals, virtues to practice Christian professionalism. There are some certain kind of mixed use of psychological the term which is most people say ethics, moral, virtue. We use those terms interchangeably. I'm gonna repeat one more time. Ethic means that's a set of moral principle. Moral principle is like a bad good, right, wrong, those kind of things. Especially that's related to certain kind of group, field, the job. Let's say you have ethics as doctors, right? You have ethics as a computer technician. You have ethics as professor. Okay. Moral is mostly same as ethics. Moral means that's also the principle. A principle which is depend on the standard. What is good, what is bad, what is right, what is wrong, what is justice, what is injustice. But when we talk about the moral, that are related to certain individual, right? I have ethics as professor, but in a general life, in my life, I have moral. Okay, yeah. So moral applies to individual. Ethic applies to certain kind of people in certain profession field, like doctors, ethics, professors, ethics. Okay. At the same time, as doctor, they have ethics. Also, when we see the person, doctor, as individual, general, he has also moral. Okay, yeah. Meaning similar, ethic, moral, similar. Virtue means you have good quality of higher standard, showing you to people that you have behavior. That's certain action. That's the virtue. Okay. Okay. Let's say virtue means when I walk on the street, I found $100 bill. Okay. So my virtue is very low. I put it in my pocket. They go away. Okay. If I have a high standard virtue, okay, I pick the money. Oh, okay. Maybe you call police or any public service. I found a bill, $100 bill. Okay, so you take care of those things. That's the virtue. Okay. So last week we talked about that. Okay. One more time. Christian professional means idea of conducting oneself in a Christian professional manner while believing to Christian value and principles. It is concept that combine element of professional ethics in general, professional ethics, and addition to it, we need a Christian faith. That's the combination of professionalism and faith. That's Christian professionalism. So, another key element of Christian professionalism, we have integrity. Integrity means also that's the talk about later. Okay, compassion. Compassion is helping people, right? And then ethical conduct. You have also ethic based on good ethic. As a pastor, you have to do conduct any kind of mission, ministry in the church. You have to do certain action and then performing things based on ethical, the principles. Okay. Also, stewardship is supervision. Managing. Okay. Service means also you have to serve to other people. That's the service. Okay. Integrity. One more time. Integrity is honesty, transparency, commit yourself, and truthfulness. That's integrity. Okay, show you a true heart to the people. That's integrity. Compassion means that's most fundamental Christian virtue. When you see people need help, you have to have hands. You have to give them the help. That's the profession, compassion. So ethical conduct that's also prioritize well-being of others. Okay, most Christian ethic is based on prime focus is you always have to consider other people's well-being, not only yourself. Also, stewardship means responsible and the management skill. Okay, that's also kind of good leadership, maybe the good stewardship. Service, okay, view their work as a form of services to the others. When you're preaching, when you do any ministry, they're all things goes to the people's good well-being or people's benefit. That's the service. Okay, let's get this. Okay, today this is second week. Today topic is we're gonna do counseling skills and techniques. There are many techniques. Depends on the psychologist. The famous psychologist, famous psychiatrist. They have a certain kind of theories they develop. We're gonna start those things today. Psychotherapy falls into five broad categories, which is psychoanalysis. First one, then psychodynamic therapist. Okay, that is developed by most famous psychologist, who is Sigmund Freud. Have you heard of Freud? He is he is also founder of modern psychology. Okay, so we're gonna learn about those things. His work, and then another therapy you use is behavior therapy. Okay, behavior therapy is that's very simple. For example, have you raised or adopt the pets, dog or cats? Yeah, when you feed the dog with treat, I say, hi, and then you give them the treat. That's the behavior therapy. Okay. Also cognitive therapy. That's Albert Ellis, Aaron Beck. Then we're gonna talk about humanistic therapy. The famous psychologist is the Jean-Paul Sartre, Martin Buber, Soren Kierkegaard. Yeah. Also, last one we do talk about integrated or holistic therapy. That means we combine all therapy theories together. Use those theories and skills and techniques combined, practice to the patients. That's integrated holistic therapy. Okay. With all those five main categories, basic things when you do practice counseling or therapy, you have to have a certain three things. The first one is active listening. Always try to listen your patient, your client. Okay, you have to pay full attention to the client. That's very important because of you get the information about patients, history, present, issues, problem. So you have to catch it, those things. That's active listening. Also, you have to have empathy. Empathy means you try to understand people, sharing the issue of clients. It is like we have words like praises, like okay, if you want to understand somebody, you have to put yourself in somebody's shoes. Once you become somebody, then you have to, you learn, you understand the people. That's the empathy. Okay. Also, non-verbal communication is also very important. When you do practicing therapy, use verbal word, written word. Also, important thing is you have to show the body language. That's also very important. When client is talking their issues to you, you have to show, yourself. You are listening to their stories, issues, problem with, like, let's say you are nodding your head, up and down. So that's, for example, that's also very good practice of body language. Also, lastly, important thing is you have to have always open mind, open-ended question. When you practice therapy, you don't need to lead a certain kind of answer. Okay, answer could be any answer. So always open-ended question. You don't need to lead a certain kind of answer from your clients. Okay. More deeply, we're gonna learn about psychoanalysis and psychodynamic therapies. That's founded by Sigmund Freud. He is very, very famous. He is almost the founder of modern psychological therapy. Okay, psychoanalysis is based on the belief that unconscious thoughts, feelings, and the memories significantly influence our behavior and mental health. Okay, psychoanalysis is based on what? Unconscious thoughts. Okay, we're gonna talk about a little bit later. Okay, psychoanalysis is based on unconscious thought. Okay, this is a little bit of explanation about. Let me see. Okay, I do. Okay, here, three part of the mind is, the human mind is composed of three things. Conscious. Okay, we're gonna go over later, okay? Conscious mind, unconscious mind, and preconscious mind. Those three things are in our mind. Okay, also another one, psychodynamic therapy is emphasis the role of unconscious and importance of childhood experience. Okay, both psychoanalysis, psychodynamic therapy, those two based on unconscious, something unconscious. Okay, so we're gonna talk a little bit of next slide. Okay, psychoanalytic counseling theory is based on psychological problem. Okay, that result from present day influence of unconscious psychological reason. Okay, also some kind of motivation that's coming from past relationships and experience. I don't know what is some experience in the past is affecting my unconscious mind. I don't know, I don't recognize, but those kind of experience is embedded in my mind when you do, let's say when you have a lot of pressure or stress, you don't know when it comes out of the experience you had in the past. Actually, that was a very bad experience, right? So those things are in our unconscious mind. Okay. All right. Okay. We talk about later. Okay, more about conscious and unconscious. Also, behavior therapy. That's developed by Ivan Pavlov. Have you heard of Pavlov? Pavlov's dog. Yeah, that's what it is. When you feed the dog. Okay, that's focus on identifying and modifying problematic behavior in order to improve the person's mental health well-being. Let's say when you have kids, elementary school, you have kids, some kids don't pay attention to teacher, or some kids they do bullying to other students. So when you students, when you follow my instruction today, at the end of the class I'll give you three. Okay, I give you free pen. Okay, if you follow my direction, that's the improvement of people's mental and then action. That's the behavior therapy. Okay, that emphasis is on identifying, assessing certain kind of behavior that is problem. Okay, more adaptive. Okay, focus first. What is the problem with some kind of person? Identifying, analyzing, assessing those kind of problem is first step. Okay, there are certain kind of behavioral techniques. We're gonna talk little late. Okay. Behavioral counseling theory has people engaging in problematic thinkings, behavior when their environment supports it. Let's say, the environment is very important. Let's say you are a very neat and clean person in generally, right? But you are living in a bad situation. You don't have, let's say, you don't have enough water to wash, or you don't have enough food to feed yourself. Your behavior is changed to those kind of environment and surroundings. That's the human nature kind of. Okay, behaviorism is behavior therapy is rooted in the principle of behaviorism, psychological approach that emphasizes the study of observable behavior and their relationships to environment. Okay, behaviorists believe that behaviors are learned through conditions and therefore they can be unlearned or modified. Welcome. Okay, we are talking about psychotherapy. One of the psychotherapy today we talk about is behaviorism that is developed by Ivan Pavlov. Maybe most people know that Pavlov's dog is very famous experiment. I'm going to show you later. Okay. Also, behavior therapy is focused on observable behavior. Observable means you watch certain kind of phenomena or certain kind of people. You have to watch. Okay. Find out the reason why that people is doing certain kind of action. Okay, that's observable. That emphasis on identifying, assessing the problems. Also, assessment, functional analysis is involved in behavior therapy. Therapists, counselors, they conduct assessment to understand the client's behaviors and problem. Okay, and then the consequences of certain kind of action, they assess those things. All right. Okay, there are certain kind of the techniques. Okay, we'll talk about this later. Okay. All right. Maybe most people know that those things. That's Pavlov's famous dog experiment. When you do psychological therapy, there are certain kind of categories. We talked about psychoanalysis, psychodynamic, behavioral therapy, cognitive therapy, humanistic therapies. In this category, Pavlov's famous dog experiment is behavioral therapy. Okay, this is very simple. Okay, some people have dog, right? When you feed, when you treat the dog with, let's say, when you feed dog, you always say hi, hi, and then give your hand to dog, grab his feet, right? And then you feed the food. You always do that, okay? Hi, grab the hand food, and then feed the dog. You do this like, more than 10 times. Then, after the 10 times of practicing, you just say to the dog, hi, then they give their feet to you, right? To shake. That's the behavioral therapy. The purpose of behavioral therapy is improve the patient's mental health and then behavior. That's the behavioral therapy. Also, we have another category for cognitive therapy. That's developed by Albert Ellis and Aaron Beck. Cognitive therapy emphasis what people think of rather than what they are doing. Okay, therapists try to find out the inner part of yourself, your feelings, your thoughts, your spirit. That's the cognitive therapy. Maybe dysfunctional thinking that leads to dysfunctional emotions, behaviors. That's very important to assess cognitive therapy. For example, by changing your thoughts, they can change how they feel and then how they do their actions. That's cognitive therapy. Change your mind is focusing therapy. Okay, also cognitive therapy is also known as cognitive behavioral therapy. When you change someone's mental health, someone's action, you have to focus to try to understand, find out what's one's inner thoughts, feelings, spirits. That's cognitive therapy. When you do certain kind of, when you do cognitive therapy, you have to do certain kind of techniques, which is free association, dream analysis, transference. Those three things are the skills we use when we do cognitive therapy. Free association is clients are encouraged to speak freely their thoughts, feelings without censorship. Just freely you try to connect with patients and clients, let them speak freely without any objection or any negative reactions from the counselor or therapist. So you have to let them speak, let them talk anything from their insight of their mind. Also, dream analysis is that is developed by Freud. He believed that dreams are a window into the unconscious mind. When you have dream, you do go into yourself to unconscious mind. You know that, right? Certain psychiatrists, certain psychologists, they do have dream therapy, right? When you make them fall into sleep, and then you talk them with your patient's dream. So let's say now, let's say the patient is 40s, they're 40s now, but when you did then fall into sleep and dream, you ask them to, okay, now you're going back to 20 years before, now you are 20 years. Then you ask them in their dreams, okay, what do you see in your dream? And then they answer. That's the dream therapy. Okay, also transparency is client's feeling, attitude towards the therapist can reveal, uncover their unresolved problems and conflicts, relationship with their past. That is called transference, and then central focus in psychoanalysis. Okay, one more. Cognitive therapy is we have thoughts, emotions, behaviors, those three things all combined. Okay, cognitive, when you have good thinking, also they affect each other's thoughts, emotions, behavior. They interaction each other. So when you have good thoughts, good emotions coming from good thoughts, also that result good behavior. Okay, that's cognitive therapy. Okay, experimental therapy versus cognitive therapy. Okay, experimental therapy is dive once into the one's mind. That's actually past experience. That's experimental therapy. You try to find out what happened in the past, the client's, experience. That helps person learn by doing actions such as following: role playing, music, art, animals. With those things, that helps experimental therapy. Cognitive therapy is uncover the thought of behind someone else's decision. That's the main difference. Experimental therapy actually focuses on certain kind of action, event, drama. In other way, cognitive behavioral therapy is focused on the someone else's feeling. Inside of your mind, thoughts, feeling, spirit. That's the difference of focusing between cognitive therapy, experimental therapy. Cognitive counseling therapy is people's experience, psychological and emotional difficult. Okay, when their thinking is out to reality. That's the cognitive therapy. Focus on your inside of your mind, your thinking, your thoughts, your spirit, your feeling, those cognitive concepts. Okay, let's take break like 15 minutes. Okay. We have time today? Okay, understandable?
Oh, I'm sorry, I didn't.
Alright.
I'm sorry.
Okay, it's okay. Yeah. Just take 10 minutes, 15 minutes break.
15 minutes, okay.
Yeah. it going? Your green card processing.
I don't know. Just wait.
You submit the document.
Yeah, I already sent.
Oh, okay.
My lawyer told me they already sent yesterday. Just
Oh,
wait. We don't know what happened. Just
okay.
wait.
You don't know when your interview is?
No.
No.
No, they didn't. Maybe.
What did the lawyer say?
My lawyer say maybe I get it. And right now,
Mhm.
anybody get a chance cannot interview it. He said.
Oh,
Maybe get a chance.
long. I mean,
It's a long life.
yeah.
To, yeah, maybe, but not sure.
Oh,
But
you
if
don't know when.
no, I didn't
Oh.
say when. So the first step we submit the document to the government.
Mhm.
The second maybe we do like interview or something like that. I'm not sure.
When?
Whatever.
Yeah.
So maybe 1 month or 2 months later.
Oh, they do have after submitting the document.
Yeah, the first
They do.
step,
Oh,
and then they make appointment.
interview.
Yeah.
Oh.
But she said, she said maybe we're trying the best to maybe we get a chance. No,
Oh.
nobody know.
Oh. Okay.
Just 30% can just avoid interview, just something like that.
Oh,
But
okay.
nobody know that one.
So how do you apply a green card? I mean, you have like marriage,
No.
or you have a relative.
Relative? What do you mean relative?
How did you apply green card?
Okay, so how do you say that word? Because I have been accountant for 20 years.
Oh.
Yeah. So that's
So-
Korean, my job.
Oh, okay.
Yeah.
Your workplace sponsor you to have green card.
Yeah.
Oh.
Yeah.
Oh, that's good. That's good.
No, we didn't. I mean, right now we didn't finish yet. We didn't get the last step,
Oh.
So we
You,
got-
you have kids?
yeah, I have 2 kids.
Oh,
One,
so you apply your husband
no,
and you
just only my son.
so you apply you and your
My
son
son,
together.
Yeah.
Oh, okay.
Yeah, my son is here. He's here. He's college student right now.
Oh, he's going to college.
Yeah, he right now he's
In college.
yeah.
Oh,
And he
can I ask what college he is in?
no he goes to the community college.
Oh, community
Because
college.
it's more cheap.
Oh, yeah. Hey, he can transfer to
Yeah, I know.
You
after
see.
2 years. Yeah.
Yes.
But he went to the what's that called? He went to the before 4 years ago he
Mhm.
went to the high school.
Mhm.
Went to the high school,
Mm-hmm.
the United States.
Mhm.
After 4 years high school, he went to the community college
Mhm.
because less tuition.
Yes.
You know, it's really important as international student. The tuition is terrible.
I
I
know.
cannot afford it.
I know.
Right?
Yeah.
So yeah, the first 2 years he right now he goes to the community college and that's good for us.
I have took his son is first one. He already graduated
Okay.
college.
Uh,
But they are born in America,
okay.
so
They are citizen. You
Yeah.
don't need to.
no tuition.
Right? You know what? You don't know as an international students we have to pay
More than
That's
10 times more.
what?
Yeah.
No
yeah.
way. You know I should my son got the offer from the UCR.
Uh-huh.
You know UCR.
Yeah.
So we have to we probably have to pay $65,000
Oh my God.
for 1 year.
Wow.
Right?
A lot of money.
Yeah. I said, oh no, we cannot afford it. It's terrible.
Oh my God.
And I have a second daughter, but she was born in United States.
Oh.
Yeah, she's good.
Oh, okay.
So,
Actually, my son, we just, I think, in the beginning of the college, we just paid him like 3,000. That's it.
3,000?
For 4 years.
No, how to pay?
He got grant. He got a scholarship.
See,
Yeah.
he is. I mean,
And then
he get the scholarship or something like that.
Yeah. He got the job in the university.
Okay.
He worked as a restaurant in the college restaurant.
I know.
Cafe.
I know.
And he worked as a library. He get paid like.
I mean, she get another job to
Yeah.
pay his tuition.
I know.
So you guys don't worry about any, right?
Yeah.
Any payment for
Yeah.
him. Oh, that's very good.
Also, my daughter is in UCLA.
Oh,
She's-
UCLA.
Yeah.
Wow.
She's
You have excellent kid.
my son was in UC Berkeley. He graduated already.
What was his major?
First he applied neurology,
Neurology. What do you mean neuro?
brain study,
Or like
or become a doctor. Science, biology. Yeah,
Oh my
biology.
god. Okay.
But he changed his major to computer science.
Oh, he like it?
Yeah,
Oh, computer science is perfect.
but he changed again.
Okay, the science,
He changed again to biology.
biology.
Yeah,
Biology, they will become a doctor again.
yeah.
Okay, not bad. But you know what? Maybe the computer science is really good
I know, but
for right now. You know
Yeah.
the AI,
Yeah.
right? It's
But
terrible.
actually, computer science, you don't need to graduate college.
Okay.
Actually, you have.
What? No, you need.
I know.
You need
There are many good sources learning about computer.
oh,
Yeah.
wow, you're so smart. So really, you get a job right now?
He's now doing internship and
Internship. Okay.
clinic. Yeah.
Okay.
To apply medical school.
Oh my God! After 2 years, right now he goes to the clinic for her
Internship. Yeah.
internship, right?
Then apply.
And
You have to have
meanwhile-
experience.
Okay. Meanwhile, she is applying for
Yeah.
what is that?
Medical school.
Medical school.
Yeah.
Wow. You have to pay more for
Yes,
years.
That's why he works.
So hard.
Yeah.
She must be work so hard. Wow.
I don't know.
Wow, you have one excellent kid, right? Wow. Good.
Okay, let's go on again. The next one, let me check the camera. Okay, next one is humanistic therapy. That is involving humanistic philosophers like John Paul Sartre, Martin Buber, and Soren Kierkegaard. They influenced this type of therapy, which is humanistic therapy. Okay. That is very focused on client-centered therapy. We call. They reject the idea of therapist, which means when you do therapy as a counselor, you talk with your client with their problems, then like you say to your client, okay, you have to do this, you have to do that. It is nothing like that. Okay, it always answer and then the good outcome. Expect that's coming from your client. That's client-centered therapy, we call it. Okay, you don't give them the direction. You don't give them. You don't lead them to certain kind of, result that you desire as a counselor. We don't do nothing like that. Okay. So therapists, they help client change their main concerns, care, and interests on their own way. Okay, that's client-centered therapy. Also, get out therapy is, we also called get out therapy, which is called organism holistic. Holism. The holism is, you don't focus on certain kind of aspect of the human. You see the person, you see the client in whole thing. That's holism. Okay. So that's very important. Being aware of here and now and accepting responsibility of yourself. Okay. Existential therapy is also focusing on the free will. Okay, what client's free will is, you need to find out. Okay, also self-determination and self-searching for certain kind of meaning, like what is life, what is a purpose of your life. That's the focus on clients' issue. Okay, that's existential therapy. Okay, one more, humanistic counseling theory has people have with themselves all kind of resources they need to live healthy and functional good life. You try to find out, the resources is basically, naturally in your client's inner self. Okay. That's the main focus. Try to find out those resources and then make the client's behavior, thought to be changeable. That's humanistic counseling therapy. Okay, this therapy approaches emphasis people's capacity to make rational change, rational choices. Rational is, the logical, okay. Logical means 1 + 1 is 2. Okay, that's the logical. When you, let's say, you have apple, for example. Okay, apple is, red. Rational. Okay. Our mind sensory system has two mindsets. One is emotional, one is rational. Okay. good example to explain those two is biologically, naturally, when we look at the apple, first mindset is that affects your mind. First step is emotional, effect. When you look at the apple, you feel like, oh, that looks delicious. Or when I look at the apple, when I try to eat apple, that helps your emotional change, which is, oh, I feel happy to have, apples. That's emotional change. That's the first step. Second, next one is rational. Rational means when you look at when you try to eat apple, rational effect, rational mind is, apple has a lot of vitamin C. When you take vitamin C, that helps your body very, very healthy. That's rational approach. Okay. So when we do process certain kind of things, the environment, always first mindset is emotional taking. Okay? Then you think rational. Okay? When you say somebody, when you say to somebody, oh, hi Jane, you very different today because you got your haircut, you have like more pretty today. That makes my announcement to that people that the Jane takes my words, my talk as emotional first. That makes people happy. Jane's mind is very happy, very up mind, very satisfied from what I taught. Then, right after emotional taking, then Jane thinking is rational. Peter told me today, I am pretty, then she thinks, maybe Peter wants something from me to help his work. That's the, rational things. Okay? Also, both very important in our mindset. Okay. So, the humanistic therapy that approaches emphasizes of people's capacity to make rational changes. Okay, when you choose something, you approach emotional first, then you have to step back, try to think rational. Okay, that's the approach of humanistic therapy. Okay, and then also health, respect for others are also important issue. All right. Lastly, 5 one of the five psychological therapy is integrative and holistic therapy. That involves not only one part of the therapy. You combine the therapies we talked about previously, like psychoanalysis, psychodynamics, humanity, cognitive. Those things are all combined in integrative therapy or holistic therapy. So many therapists don't don't connect, don't learn themselves to a certain kind of one approach. Instead, those things they try to blend all the good elements of different approaches and therapies. Then tailor, combine those treatments to your client's certain needs. That's the integrative and holistic therapy. Okay, this integrative therapy emphasis people's capacity to make a rational change and choices and develop to their maximum potential. Okay, and concern and respect for others are also important part of these things. Okay, next one. Okay, we talked about 5 categories of psychological therapy. First one, psychoanalysis therapy, psychodynamic therapy, humanistic therapy, cognitive therapy, behavioral therapy, lastly, integrative therapy. Okay, those were brief explanation. Now we are gonna talking about the skills and techniques of those 5 categorized therapies. Okay, first we're gonna learn psychiatrist and psychologist therapy related to those 5 different categories. So we are more focusing on the theories of psychiatrists and psychologists, their skills and techniques to counsel your clients. Okay, first, psychoanalytic theory. That's also we talked about previously. That's developed by Sigmund Freud. Okay. Sigmund Freud is Austrian neurologist and then the founder of modern psychoanalysis. Okay. The goal of his therapy is his therapy helps clients bring into the conscious from the unconsciousness. Okay, that helps client work through development stage that was not reserved or where the client became fixated, which means you focus on unconsciousness of your client, try to develop from those things to reality, consciousness. Eventually, you change, you look up unconscious mind, bring those things, anything from unconsciousness, bring certain thing in unconsciousness to reality. Then that affects your behavior, your present mental health. So you try to change present clients, himself or herself, behavior and mental health. That's the main focus. Okay, also that helps client adjustment to the demand of the world, intimacy, and the society. Focus, try to find out what is unconscious mind that he has, then bring it to reality and try to fix problem, issues that result, make clients adjustment to society. That's the main goal of the therapy. Okay. One more time, psychoanalytic therapy is a therapeutic approach and then theory of mind developed by Sigmund Freud that emphasizes the role of unconsciousness that shapes present your behavior, client's behavior, thoughts, feelings. So this therapy tries to uncover repressed memories, desires, and also traumas through techniques like tree association and dream analysis. One more time, when you see your client, he has a certain kind of issue, problem now. The Sigmund theory is you look up your client's inner mind to find out what is unconsciousness that is shaping your present herself, client's present herself, present himself. Try to uncover, try to find out what is unconscious that shape your client's present himself or herself. That's the main focus. Then try to fix, advise, help the present behavior, thoughts, feelings. Okay. The method, the skill we use is dream analysis. Okay. Most people know that dream analysis. Okay, with psychiatrists, psychologists, when they client is with psychologists, they do dream analysis, which is like the psychologist help client fall asleep, make them into the dream. Okay, so let's say, for example, you say you to your client, oh, now you are in the deep sleep. Then let's say going back to your dream in 10 years before now. Okay, so we ask them, what do you see 10 years from now, before? Client said, oh, I see I was playing with my daddy, my mother. That's unconsciousness. Okay, if there are problem with in that, the unconscious mind, psychologists, psychiatrists try to find out the problem in that time. Then use those things, present problem or clients. That's dream analysis. Okay. Sigmund Freud is he has theories that's psychosexual theories. We call individuals progress through 5 sexual stages. That's complex at each stages that can have a lasting impact on your personal or your personal behaviors. Okay. Also, psychosocial therapy. We progress through 8 life stages, each characterized by social conflicts and influences our personality. That's his theory also. We want to talk about later. Okay. Also, one more time, psychoanalytic theory. Sigmund Freud is founder. Okay, he is Austrian in Europe. He is neurologist and founder of psychoanalysis. He used clinical method to evaluate treating pathologies seen as ongoing, originating from complex in psyche through a dialogue, talking with the patient, your client, and then discover the unconscious, the things that affects his client's present herself or himself. Also, in this therapy, role of counselor. Okay, as you are counselor, what can you do to your clients? You can encourage the development of transference. Transference means you change. Okay, you are not trapped in the past. You have bad experience, you have bad trauma in the past. With those things, clients comes into your office. He was trapped in, that feelings, that trauma, that thoughts, that experience. But transference means you change your client's status focused in past to present reality. Okay, that's transference. That gives clients a sense of safety and acceptance. With therapy ongoing, you help your clients not trapping not be trapped in the past. Okay? Bring them to present and reality, to give them the safety, the satisfaction. Okay, that's the main goal of, the role of counselor. Also, clients freely explore difficult material experiences from their past, gaining, acquiring insights, and working through unresolved issues. So the counselor is expert, who interrupt the client's unsolved problem issue. So counselor is trying to help the client's past experience trauma. Get your clients out of those trauma experience in the past to the present. Okay, try to solve with those kind of techniques. All right. Okay, one more. Analytical theory. That's Sigmund Freud. Okay, also one more time. Role of the counselor is encourage the development of transference, change. You're not trapped in the past. Come to the real life. Okay? Try to find out unsolved issues in the past. Try to help them resolve, fix those problems in the past that affects your unconscious mind. Okay? That's the role of the counselor. The techniques we use, psychoanalytic theory is, there are many, but here we have several techniques, which is free association. Another one more time, dream analysis. Okay, also analysis of transference. Then analysis of resistance. Lastly, interpretation. Okay, those are all techniques we use in psychoanalytic theory. Okay, go deeper into the skills we talked about. Okay, free association is the process where the client verbalizes any thoughts that may be without censorship. Okay, censorship, okay, is like, okay, you need to talk about this. You don't need to talk about it. It's nothing like that. Free mind. Any thoughts, any feelings that your client has is to be spoken freely. Okay, that's free association. Also, dream analysis we talked about. It's process where the client relates their dreams to the counselor. The counselor interprets, understand the obvious or the contents of your client's dream. Okay? Try to find out the hidden meaning or concealed contents of your client's dream. Okay? Try to find out your client's dream. He says something. Try to find out what's the true meaning. Okay? What's the true meaning of their contents in their dream? Then we go more to analyze. Okay, analysis of transference is that's the process where the client is encouraged to attribute, to give to counselor the issues that he has in the past that cause the difficulties in the present reality. So counselor is helping the client to gain insight. Insight means is deeper, intuitive, understanding. More understand to their problem they have now. And that's actually, it could be your client's conflicts, feelings. Analysis of resistance is also the process where the counselor helps the clients gaining understanding of what caused, what forms basis of your present issues. Try to find out the reason why you don't want to do certain kind of behavior in the real life. What makes you hesitate to do certain kind of action? That's the resistance analysis. What is holding you back? Try to find out the reason and then cause. That's the resistance therapy, analysis. Then lastly, interpretation is the process where the counselor helps clients gaining understandable the past and then present all together. Okay? You don't live in the past. Get out of those bad experience and then feelings, thoughts. Okay? Try to face your client today. Face real life. Try to fix the past issue. That's the interpretation. Okay. Also, Sigmund Freud. We are still talking about Sigmund Freud. Freud is very famous. Psychologist. Actually, he is neurologist. He has theory to understand our mind more deeper. Okay? This is all about Sigmund Freud theory. First, when you look up the string, our mind is composed of 3 stages. Conscious mind. Another one is preconscious mind. Lastly, unconscious mind. Okay, we're gonna subdivide. Consciousness is, okay, when you look at the iceberg, top part you can see from the sea, right? Antarctica, the Arctic Sea, you see, big iceberg. Top part that you can see is consciousness. And then submerged under the sea, you don't see. That's subconsciousness. Okay, subconsciousness has 2 stages. Preconscious mind, unconscious mind. Okay, unconscious mind, some experience, trauma that affects your conscious mind. But now you don't know. In conscious stage, you don't know what exactly is. In the past, you experience, that's the unconscious mind. Okay. Conscious mind, logical mind. In the real life, that affects your true yourself. Okay, that's logical mind. It's the work when you're awake, analytic. You can analyze anything. Your environment, your nature, your work. Yeah. That's all inclusive in conscious mind. Also, you have the power, your ability, right? In conscious mind. You're the master of yourself in conscious mind. Also, that work as filter. Okay, let's say you are educated, or you have a certain kind of ethics, morality that works as filter. The source unconsciousness is coming, but it goes through the filters. Your morality, your ethics, your education, those things are now is conscious. Conscious mind filtering unconscious trauma, thoughts, experience. Okay, also let's say we have a subconsciousness. We don't know, it doesn't come out your conscious mind. It doesn't seem to affect your real life in present. But we don't know what it is. Anyway, it is in our mind, in deeper location. Okay, subconsciousness is not logical mind. Okay, logical mind. So what is logical mind? Logical is certain steps takes in orderly, right? Let's say 1 plus 1 is 2. That's logical, right? when you look at the apple, logical mind is like this. When you look at the apple, oh, apple has red color. Apple has vitamin C. Okay, so that makes my health good. That's logical mind. All right. Okay, subconscious mind. That anyway, that works for ourselves 24 hours a day. That always affect us. But sometimes we don't recognize. You do certain kind of action, right? It coming from subconsciousness, but you don't know that. So it has unlimited power. Okay. Then also that has no filter. Okay, more definition to conscious mind. Conscious mind represent the thoughts, feelings, perception that you are currently have in your mind, in your awareness. Okay, that's the current mind of yourself. That's conscious mind. That is mental experience that you are actively thinking about, or experiencing in the present moment. Nowadays, you experience, you think, that's the conscious mind. Okay, that includes your immediate thoughts. It could be instinct thoughts. Sensation, your emotion. Also, as well as your awareness of external world, outside of yourself, your environment. You aware, oh, what's going on in the world? That's the conscious mind. Now, for example, you are studying now, right? That's the conscious. You're currently reading the text, and then you are thinking about, the contents of the text. That's your conscious. Okay, that engages in present processing of the information about the text. That's the conscious mind. Okay, 7 minutes left. Okay, we're gonna finish free conscious mind and unconscious mind. Briefly explanation. Okay, that's okay. Let's go over two more. Preconscious mind. The preconscious mind contains thoughts, memories, information that are not currently in your conscious awareness. Okay, preconscious is not part of your present conscious mind. Okay, that can be easily brought to consciousness with minimal efforts. Actually, these are memories, thoughts you might not actively thinking about right now. Let's say lecturing, right? Preconscious mind. I'm lecturing, but I am focusing my material, my mind to lecture, but just blink of second, I thought, oh, it's 12. Oh, I'm getting hungry. That's preconscious mind. Okay, so now you could bring anytime with your efforts, thinking of those things. My instinct for food is coming out right away. That's preconscious. Okay? So these memories are thought that you might not actively thinking right now, but when you try to think, it comes up right away. Okay? For example, when you think the lunch, you feel hungry. Okay, that's the preconscious. Okay, but you can access them if you choose to record or bring them to the prefront of your mind. Once you bring the food, in the lecture, now I'm giving you, but I keep thinking of having a lunch instead of giving you the lecture. Let's say if somebody asks you about your last vacation, you may think about the time to bring those memories from your conscious mind. You're not always thinking. Somebody asks you, oh, what was your last vacation? Then you can bring anytime to actively think in present conscious mind. Okay, somebody asks, okay, what is your what is your best food last year you tried? Then you try to think and bring it to present. That's preconscious. Okay. Then let me see. Lastly, Okay, last one, unconscious mind. We have 2 minutes. Okay, unconscious mind. The unconscious mind is the deepest. You could access, but it's not easy to access those memories. Okay, but it is part of your mind. That's according to Freud's model. That contains, unconscious mind contains thoughts, feelings, desire, memories that is hidden, that is concealed, that is uncovered from your conscious mind. You don't know what it is now, but anyway, it is in your unconscious mind. Many of those contents of unconscious mind is, thought to be repressed or kept out of your conscious mind, because they are the reason why sometimes you have a bad experience, trauma in the past, and that is part of your unconscious mind. You don't want to bring it because it was stressful. When you have trauma in the past, you don't want to bring it to present because it is stressful. It is pain, right? So that becomes part of your unconscious present. So you try to keep that out of your conscious mind. Why? Because it is distressing, unacceptable, or conflict. It makes conflict. Okay? One more experience. That's my own experience. Let's say I have fight with my friend in childhood. I was beaten,